So first of all, you know, hi, welcome everyone. I see a few new faces on that I haven't seen on these calls in a while, so that's great. Um, I just wanted to share a little bit about what our office does. And actually, this came up because I've been traveling around the state, visiting with a lot of our stakeholders, and um, trying to connect them with resources that they weren't aware that they had available to them. So I thought it would be good to kind of give you an overview of what our office does, what we have available for you all and others who are looking for resources for funding, applying for grants, etc. So I wanted to share first a little bit about where we sit within the bigger Department of Health Services. So we're actually under the Bureau of Women and Children's Health, which you can see there on the left side of the screen, which is under prevention, the Division of Prevention and the Division of Public Health Services, and then sitting right under the governor's office. And the reason I wanted to highlight that we're under the Bureau of Women and Children's Health is that they are one of our major funders. So the state receives block grant funding from Title V. And currently, every 5 years, what we do is we set the health priorities for Title V. And one of the good things is oral health is currently one of the priority areas, but you can see all of the other areas that we invest resources and funding into. So adolescent health, children's health, access to care, oral health, and assessment and evaluation. So we are currently set to close this cycle in 2025, and you will probably see me reaching out to you early in 2024 because our stakeholders are the ones who determine where our priorities fall. And the last time we did the needs assessment and did focus groups and engaged partners and stakeholders, these were the top areas that came out. So another thing that I wanted to kind of highlight is that our office is implementing dental public health strategies. And I wanted to cover what dental public health is not before we get into what the Office of Oral Health is doing. So what our office does not do is volunteering. So meaning that when we give funding to communities, it's not, we don't expect them to engage volunteers to deliver those services, that we want to provide our partners and stakeholders with funding to provide oral health services. We don't provide what we would consider direct services or treating patients, such as restorative care, providing dental care. We are not considered the providers of welfare or Medicaid dentistry, or the provider of last resort, or community dental health. So community dental health are those partners that are on the front lines, such as those in FQHCs that are providing community dental health. We are not, so what we are focused on is population-based dentistry, oral health surveillance, policy development, community-based disease prevention and health promotion, and maintenance of the dental safety net. And I'm going to get into a little bit more and explain the details of each of those. So, you know, the core functions of our office are focused around assessment, policy development, and then quality assurance. So for assessment, one of the things that we do, and some of you who are on the call are very familiar with, is we conduct oral health screenings on children in specific age groups, kindergarten for school readiness, which we partner with First Things First. Katrina's on the call, so she can verify that. And then third grade. So the specific age groups are based on tooth eruption stages and are predictors of future oral health. Another thing that we do in addition to the oral health indicators, including caries experience, untreated tooth decay, dental sealants, we also do height and weight. So this is a partnership between our Bureau of Physical and Nutrition Services, where we collect height and weight information on kids in kindergarten and third grade as well. I put up First Things First last report that came out, because theirs is much prettier than the one that we put out. And it's 2016, with the intent that hopefully by the end of this calendar year, we will have they will have a new report that is published. We collected the data through the years of 2019, completed it just this spring in 2023, and now we're in the process of crunching the data, for lack of words. So another thing that we do is, this is from our last oral health survey. It was from the 2016, not the First Things First oral health report, but it shows the prevalence of, and it's covering my screen. Does it say decay experience at the top? I can't get this thing out of the way.
Yes, percent of third.
Oh, yes. Okay. Yeah, there. It opened up. So the percent of third graders with decay experience, we map it by county, so you can see that the darker areas have the higher prevalence of decay experience and the lighter areas have the lower prevalence. But the interesting thing is that we're still above, even in the lowest county, we're above the percentages for the nation in decay experience. So this is just one map that we do. We do a lot of other maps on untreated decay, on sealant prevalence, but I didn't want to bore you with the details of that, and I would be happy to share those if you're interested. So I wanted to highlight some of the other surveillance activities that we're focused on, and that is for the behavioral risk factor surveillance system. And this system is a phone survey of adults throughout Arizona, which collects information on demographics and health-related risk behaviors and chronic health conditions. So I just put two things up there that are related to oral health. There are a lot of other things that we look at as well from this survey, but you can see tooth loss by smoking status, tooth loss by diabetes. Some of the other chronic diseases that are featured in this database are cardiovascular diseases as well. The other surveillance tool that we're actively collecting data on is the pregnancy and risk factor monitoring system. This collects demographics on women that have given birth and preconception on services that they've received, information that they received either preconception or postpartum. And I put up the dental visit among pregnant women in Arizona. You can see 10% were after pregnancy, less than 1 year, 32% during pregnancy, and 58% had no dental visit. So this is an area where we're trying to do some health promotion and education on getting those dental visits in either pre-pregnancy or during their pregnancy, before the baby is born. The majority of this information is reported to the National Oral Health Surveillance System, which is housed on the CDC website. This is where you can look at how Arizona compares to other states that collect the same type of information using the same methodology. The other quality assurance component of what we do is implementing evidence-based and best practice programs. So one of those programs that we focus on is the school-based sealant program. So that's providing dental sealants to 2nd and 6th grade children who have permanent and second molars that attend schools that are at a high free and reduced lunch percent. So we target those underserved, higher risk populations through the school-based sealant program. The other piece that we're very focused on is community water fluoridation. So helping communities either implement community water fluoridation or maintain it. And as you can see, rather than adding to our communities that are adjusting, Bisbee stopped fluoridating in 2018. Yuma stopped fluoridating around 2015. And it's a constant challenge, I will say, to provide communities with information on maintaining their optimal adjusted levels. I also wanted to share the communities in Arizona that are naturally fluoridated. You can see we have quite a few that meet that range that is considered optimal, that is naturally fluoridated. This information is reported into My Waters Fluoride. However, since there is no mandate for systems to report unless they go over the maximum contaminant level, we always refer individuals who are looking for the levels to their utility company. That's the best source of information, since there's no mandated requirement for them to report to us or into this system. The other piece, the policy piece that we're really focused on, is helping childcare providers implement policies, health policies that will have a positive impact on the children that in their center and also their families. And Empower was originally established as an effort for ADHS to help licensed child care centers reduce their licensing fees. And if the center adopted 10 health policies, one of those, which was oral health, they would get their licensing fees reduced by 50%. Well, those efforts have gone away. However, the Empower resources continue to remain as part of incentives for childcare providers. And oral health is one of them. And one of it is around implementing a toothbrushing program for children or providing oral health resources for children and families. So that's Empower. The other piece, and I saw Tracy on the call today, which she's very familiar with, is that we do loan repayment programs. So there's state loan repayment programs and NHSC loan repayment programs that are available for dental providers. We also have a program, which is the preceptorship grant program. Currently, there's funding going to the Arizona Dental Association to help incentivize preceptors to take on graduate students and education. We also provide continuing education free to those who attend our courses, and then also internships. So we take students taken students from all across the country who've done some wonderful work with our office when around dental public health. The other piece, which I think most of you on the call were very instrumental in our last state oral health plan, finding the keys to Arizona's oral health issues. And of course, it has expired. So we're looking for opportunities to update that plan moving forward. But also we have worked oral health into the current Arizona Health Improvement Plan, which is 2021 through 2025. I actually was on a call this last week and I didn't see anyone on from the Oral Health Coalition on the call about the Arizona Health Improvement Plan. So we'll be making sure that you get those invites to that to the next meetings for that. So I wanted to share a little bit about the changing oral health landscape, and I see both Katrina and Sandy on the call. And if I have any of the information incorrect, please chime in because I had to do some digging to find some of this information. So this is from FY19, state fiscal year 19, FDF had funded oral health strategy across 16 regions. And the results impacted about 24,000+ children with either screening and or fluoride varnish. Here is a little information on the funding that was provided at the time for 2018 through 2022. And then currently we're taking a look at the current oral health strategy around fluoride varnish and screenings, and it's 4 regions. Is that correct, Katrina?
Yes, it is.
Okay, good. And so here's the amounts that the 4 regions currently have, and we're so thrilled that these regions are still investing in resources around screening and varnish for children. So here I wanted to show you where we were with county health departments that had an oral health program or an oral health strategy. And you can see we had Coconino County Health Department had an oral health program, as well as Navajo, which also they would go into Apache County as well. Gila County, Maricopa County, Pinal County, Pima, Cochise, and Yuma. And currently what we're looking at for being able to partner with the county health departments for our sealant program is Maricopa, Gila, Pima, and Pinal. So things are shifting a little bit there as well. So I am going to stop sharing and I'll take any questions from you all. But did I stop sharing? Yes. A little bit of the information that I wanted to share around the funding is that, like I mentioned, the majority of our funding comes from Title V, which mainly goes to our sealant program providers for program implementation. And additional funding we're able to use, there's an oral health fund, which comes from money that we are able to get as far as access reimbursement for providing services to access eligible children. So that's a little bit about our office, and I'll take questions if any of you have them.
Hi, Julia. It's Melissa from First Things First.
Oh, I didn't see you on. Hi.
Oh, that's okay. I came a little bit later. Hi. Thank you for doing this. This was